problem is when we go into the industry and we go into the health system with the concept of wellness behind us, we interfere with that bell curve and we cut into revenue because we reduce the need for medications, we reduce the need for healthcare, and we get a lot of pushback from the system. So to give you a little bit of background, I've been in the UAE for the last 15 years working in pretty much every element of the health system, from the payers to the regulators, to the patients, to the providers. So I've been in every spectrum and every element of the health system. And over those years, I've landed up becoming an entrepreneur and building out some of the innovations that we see today in the health system. And now I help other businesses to establish themselves in this framework. I wanted to talk a little bit today about one of the major blockers that I see almost every day with companies and with startups that are entering the market in the wellness space. So what I'm going to talk about is a little bit about the health system and why it's not very favourable for wellness and wellness innovation, and what we can do to make it a little bit more amenable for industry, for startups, for companies, and for entrepreneurs that are trying to improve public health by keeping people healthy. So I want you to imagine for a moment an environment where wellness and prevention are as profitable as medication and surgeries. An environment where two systems operate side by side, a healthcare system for the sick and a health retention system for the well. So without intending to, global health systems have kind of got us caught in an artificial suspension, somewhere between healthy and dead. The point on the bell curve where we need the most healthcare, where we generate the most revenue and provide the greatest return on investment for expensive healthcare, is basically where our prime position. The problem is when we go into the industry and we go into the health system with the concept of wellness behind us, we interfere with that bell curve and we cut into revenue because we reduce the need for medications, we reduce the need for healthcare, and we get a lot of pushback from the system, which makes it really difficult when we're going in to try and save lives and reduce sickness and increase health. So the funny thing is there's a lot of conversation about how to fix that problem with the health system, and my position on that is that the health system is not broken. The health system is actually optimally built. It does exactly what it's supposed to do. The healthcare system is built for treating acute, emergent, critical conditions, for treating people that are unwell. What it isn't built for is longevity, wellness, and prevention. We're stepping out of the scope of what the health system was designed for, and it honestly is just not supportive of anything that reduces cost of care or reduces demand. So the idea of what I'm here to talk about today is the idea of keeping people healthy outside of the health system. We need a new framework. We need to have a framework that's focused on wellness that happens before the health system kicks off. We need a system that's designed to keep people healthy, to promote the longevity, proactive healthcare and wellness from the very start. And this system does need to operate independently from healthcare. Different incentives, different business models, and it should be based on three different pillars. 1, early stage intervention, 2, health retention, and 3, disease prevention. This healthcare architecture should operate in practice by integrating wellness, early detection, and health technologies into a cohesive system. One that services these functions independently with a different payer system, a different regulatory structure with new regulations that support the business of wellness and preventative care, regulations that empower people to stay healthy using technologies, lifestyle changes and health management practices. The different payer system should incentivize people to stay healthy instead of getting sick, and it should have a new set of objectives. The goal of the wellness architecture isn't to treat the sick, obviously, it's to stop people from getting sick. The objective is to keep people out of the health system. This framework isn't about replacing healthcare, it's not about changing the healthcare system, but about reducing the demand for it. It would dovetail into the health system, but only when health becomes critical, when there's an emergency intervention required, or when there's genuine sickness in place. The end result is a clear proposition for wellness in society. Better public health, but also a wide open opportunity for us to explore innovations in health retention and for new businesses like the ones that I see every day that are super effective at keeping people well, keeping people out of hospitals and off medications. This isn't just a concept, so we're all operating in some way, shape or form in this area. We have clinics based on wellness, we have longevity standards coming out from the government, but they need to be isolated into a different framework. This is something that I think is a fundamental issue that needs to be resolved before we can truly recognise the benefits of wellness and wellness entrepreneurship. That is all I have to say.